Hello, everyone. A very good morning to you all. And this is your lecturer, Dr. Mrs. Omogiade. So I'm live now. I want to give us the next 5 minutes, 5 to 10 minutes. So if you can see this live, join in, invite your friends to join in. You have a few minutes to join in, students. Join in, invite your classmates, invite your friends to join in. We are doing GST 125 today, GST 125, which is on contemporary ethical and legal issues in health. Contemporary ethical and legal issues in health. Then we have the areas we are going to be dwelling on: ethical dilemmas in healthcare, human rights and health emerging issues in bioethics, e.g., we'll be looking at health euthanasia. We'll be looking at genetic engineering. So join in. We have spent a minute already. Join in. So we are two lecturers actually taking this course. Two of us. So the other lecturer will take the students on contemporary ethical and legal issues in health. So she's going to be dwelling on that, contemporary ethical and legal issues in health, while I will be dwelling on ethical dilemmas in healthcare, as most especially looking at human rights and health emerging issues in bioethics. We'll look at health euthanasia, we'll look at genetic engineering. So I know some persons are live now. If you can see me, please let us know. Just say hi at the comment section. Hey, say hi, then tell me your name as a student. Now I told us how I'm going to be taking my attendance on this lecture. I'm going to taking it live, yes. So if you can see me and you can see what I am doing, and you are my students, we are one of my students taking this GST 125. Signify by saying hi. Go to the comment section. Go to the comment section and say hi. Say hi there, then write your name. Say hi, then include your name. Go to the comment section. I'm trying to check. Okay. I hope everyone can see me. Can we see me? I want to give us opportunity for everyone to be around. Yes. If you can see me, say hi. If you can see me, just say hi in the comment section. Before we kickstart, I want to be sure that my students are around. Show most material with potential Spanish. If you can see me, say hi, then put your name down. Say hi and include your name. I'm still waiting for us, so I would have kickstarted the lecture. Okay, I can see. Put your name. Let's know who we have. Yes, no, it's not just enough for you to say hi. Apart from saying hi, include your name. I told us to do an introduction. I had reasons for it. You know, I told us as students I'm going to be taking my attendance here online. I gave us an instruction since morning, more than an hour. Nobody said anything. Okay, I can see Hemwa Mitchell. Okay, you are live, yes. So Hemwa Mitchell, tell other of your classmates, tell them that we are live now, because I told us I'm going to give us just 5 minutes. The next few seconds, I'm kicking start the lecture. The topic is on contemporary ethical and legal issues in health. We are going to be looking at ethical dilemmas in healthcare, focusing more on human rights and health emerging issues in bioethics, taking health euthanasia and genetic. Who's offside? Tell us your name. Offside is not a name now. I know I've seen a Hemwa Mitchell. A Hemwa Mitchell, I've seen you. Okay. So, Hemwa Mitchell, I've seen you. I wanted to know, because this live is not just for my students alone. I wanted to know those ones who are my students. So, apart from saying hi, just tell me, say hi, include your name, Hima Mitchell. Then the next thing you tell me is, I am one of your students, because you people did not do the introduction on WhatsApp. Yes. From there, I would have known who is my student and who is not. This one is not just for you people. Yes, I have some other persons who are joining in. But if you can see me and you are my student, say hi, include your name, then let's also tell me that you are my students. So the only person I know I can really talk about now is Ehemwa Adesua Mitchell. Yes, though she has not told me she's my student, but I knew her because she is the class rep. So just say hi. Then if you have not subscribed on my channel, go and subscribe. Go and subscribe. Hit the subscribe button. It is free of charge. You're not paying for it. Hit the subscribe button. Yes, so that whenever I post lectures like this, you will be aware of it. Yes. So from time to time, apart from this aspect, I'm going to be posting some other lectures and things that also pertain to students. Yes. Who is a court later? Okay, so you hit the subscribe button. Okay, I'll check. So for those who are my students who are offering this lecture, GST 125, for attendance sake, I'm going to be taking my attendance. For attendance sake, tell me, say hi, tell me your name, then tell me I am one of your students. Simple. Obedience is better than sacrifice. So I'm going to start the lectures now. I think I've seen a Himwa. I've seen a Himwa Mitchell. Okay. So I'm expecting others. Yes. I've seen a Himwa Mitchell. I'm expecting others to come up. Say hi. Say hi. Let us know your name. Then just tell me I am one of your students. Don't tell me the university or wherever. I'm not interested. Just let me know I'm one of your students. So I said we are two lecturers, and the other lecturer is going to be taking you people on contemporary ethical and legal issues in health. This is a very wonderful topic. Yes, don't miss it for any reason. So as the lecture progresses, if you have questions, let me know. Yes, then please don't forget to like it. You can even share. For those of us who are my students, you can share this live to the WhatsApp group. Yes, Mitchell. Okay, I've seen Mitchell. Yes, Mitchell, you can share it. Okay, you can share this live to your WhatsApp group so that your colleagues will see it, and from there too they can join us. So we'll go straight to the topic. We have our lesson objectives for today. We have, at the end of this lecture, these are some of the things our students should know. One of them is they should be able to explain the relationship between human rights and health. They should be able to tell us what is the relationship with human rights and health. So I'm going to tell you what human rights is and everything, but a student should be able to know what is the relationship between human rights and health. 2, you can jot down if you have your notes. 2, our students should be able to discuss emerging issues in bioethics, such as euthanasia. When we say euthanasia, what do we mean? Well, when we say genetic engineering, what actually do we mean? Our students should also be able to identify legal responsibilities of healthcare professionals. Okay. Our students should be able to identify legal responsibilities of healthcare professionals, because as students, you are not just going to school for just that sake. No. By the time you graduate tomorrow, some of you are going to be some may be doctors, some may be medical scientists, some may be nurses, some may be public health professionals, different healthcare area or profession where you belong to. So you should be able to know what are those legal responsibilities of healthcare professionals. Some of those things you do, they have legal implications, yes. And if you are not careful, you go in for it. Then students, they should also be able to, at the end of this lecture, apply ethical reasoning to healthcare situations. There are some situations that will come your way. So you should be able to apply ethical reasoning so that you will not be held liable. So let's just kickstart while others join. So like I told us, if you are my student, let me know. Say hi. Tell us your name, then also tell me I am one of your students. So for those who are not my students that are joining in, you also benefit. This topic is wonderful. It's a wonderful topic, yes. It's something that you don't hope to miss for any reason. So make sure for my students that you have marked attendance for this lecture. So kickstart, what are human rights and health? Definition of human rights. Human rights are basic freedoms and protections entitled to every person regardless of race, gender, religion, or nationality. Everybody created by God on earth here has their own human rights. We have basic human rights. Okay, so whether you are a man, you are a woman, be you a dark person, be you a fair person, be you a Nigerian or you are not a Nigerian, everybody has their human rights that must be protected. So we'll now look at what is the relationship between human rights and health. Now, health is recognized internationally as a fundamental human rights. You know, when you say human rights, I will list them out so that we understand what this human rights is, so that we understand that one of the human rights that we have in our constitution in Nigeria is what? The right to health. So what are these rights? The right to health includes right to health, like I told us, is one of the human rights. Now, what are the right to health? Have freedom of speech is one of the human rights. You should be able to speak out, yes. Freedom to speech, freedom to education, freedom to your health, and some other human rights. Now, when we talk about the right to health, what do we mean? Everybody should have access to health care services. You should be able to go to the hospital, that you are sick, and when you get to the hospital, the healthcare professionals are what? They are supposed to attend to you. If it's an emergency case, the person should be attended to immediately in order to protect such a health. So your right to health includes, take note, access to healthcare services, safe drinking water. Those days, we used to have what we call pipe-borne water, where the government will just have a very big tank where they have water. The water is for everybody. That water is a water that has been treated, so that whoever takes it will not come down with issues that concern waterborne disease and the rest. So everybody should have right to what? Safe drinking water, adequate nutrition. Yes, adequate nutrition. That's why you see from time to time our government establishments, from time to time they tell us, they come out on radio, come out on television, etc. You know, at times they go to schools and other places, talk about nutrition or things you should take in order to stay healthy. So we said the first human rights when it comes to health here is what? Access to healthcare services. 2, safe drinking water. 3, adequate nutrition. 4, sanitation. Everybody has right to sanitation. That's why you see that from time to time there's something called environmental sanitation, where the government will declare that, oh, from so and so hours, everybody stay indoors. Nobody should come out. Take off your environment, make sure your environment is clean in order to prevent the outbreak of diseases. Another right here we have is non-discrimination. We are not supposed to discriminate. Somebody comes to the hospital, for example, the person is seriously ill. The healthcare professional is not supposed to be discriminated and say, this person is not my brother, this person is not my sister, or they'll not say, go, you are a white person, I'm a black person, so I will not attend to you. No. Because you are a male, I'm a female, I will not attend to you. No. There should be non-discrimination. Now, what are the principles of human rights in healthcare? We have principles guiding human rights in healthcare. The first one here is equality and non-discrimination. I've said it before. Equality, everybody is equal. When you go to the hospital, people should be attended to equally. There should be nothing like partiality. Everybody should be treated fairly. So there should be nothing like gender discrimination or any form of discrimination. No. So that is one of the principles of human rights in health care. We say examples of such discrimination. We have gender discrimination. We have racial discrimination. We have disability discrimination. There should be nothing like, because this person does not work, or he does not talk, or he does not do. Everybody should be treated fairly. Class, students, I hope we're understanding. So just follow me, you understand better. Then also HIV/AIDS stigma. Of course, those days when HIV/AIDS was actually reigning. You see, anybody that they confirm is HIV/AIDS positive, hey, it's like a death sentence. Nobody wants to mingle with such a person. Nobody wants to associate with such a person. That person, there's a stigma attached to it. And before you know, it may not even be the HIV/AIDS that is killing that person. That stigma alone can kill. So there should be nothing like HIV/AIDS stigma. That's another area of discrimination. We don't want such in healthcare services. So under the principles of human rights in healthcare, I've talked about 1. We said equality and discrimination. We have talked about some examples of discrimination. So 2, under that principle, we have dignity and respect. Dignity and respect. Patients must be treated respectfully regardless of condition or status. There should be nothing like he is a big man, she is a poor man. Because he's a big man, he should not be respected. Should be respected. Because she's a poor man, she should not. No, everybody should be treated fairly. When you go to the hospital, whether rich or poor, that is why you see that when a poor person goes to the hospital, the government, the healthcare professionals, what they do is they will attend to the person, even if the person does not have money to spend yet. They will attend to the person. Then at the end of the day, they will calculate the bill. They will make sure the patient will remain in the hospital until that patient is able to clear that bill. But they must attend to that person. They must save that life first. So people should be treated with what? Dignity and respect. Patients must be treated respectfully, regardless of their condition. Whether they are poor, whether they are rich or whatsoever, they should be treated respectfully. So the third one here, we are going to be looking at principles of healthcare now. The third one is participation. Participation. Individuals must be what? Should participate in decisions affecting their health. Individuals should participate in what? In decisions that are affecting their health. Somebody comes to the hospital, for example, and is given a drug. The person should know what the drug is. If the patient should ask, what is this drug for? The healthcare professional should be able to tell that patient, this is what this particular drug is for. Not go and sit down, go and sit down. It does not concern you. No. There should be nothing like that. The patient should be able to participate. When they ask some questions concerning their health, they should be given what's good and reasonable answer. The fourth one we have here as one of the principles of healthcare is accountability. We say governments and healthcare institutions are responsible for protecting health rights. Government is supposed to be held responsible. That's why you see that when people are clamoring, government should give us hospitals, they should employ enough staff, not just enough staff, not quacks. They should employ capable hands, people that will assure that these ones, they have training. They will be able to take care of these patients. So government should be held accountable when it concerns what? Protecting health rights. So I've looked at some of the principles of healthcare, yes, as concerning human rights. So we move to the next one. We have the human rights violation in healthcare examples. What are those areas where a healthcare professional can violate a patient's human rights? What are those areas where a healthcare professional can violate a patient's rights? I'm going to be asking us questions. So before we continue with this, please, if you are my student and you are watching me, say hi, then let us know your name for attendance sake. Then also let me know that you are one of my students. Yes. So we have a lot of persons here. But the only person I can recognize as my student here now is Ehemwa Adeswa Mitchell. Yes. She has played her own part. So others, I'm waiting for you. So say hi if you're my students. Say hi. Then please tell us your name and also let me know if you are my student. So we'll kickstart. Please, if you have not subscribed, go and subscribe. Go and click the subscribe button. I hope you are enjoying this lecture. For those ones who are watching me, if you are enjoying the lecture, let me know at the comment section. So we'll move to the human rights violations in healthcare. What are those areas where a healthcare professional can violate a patient's human rights? One of them is denial of treatment. The patient comes to the hospital and you are denying that person treatment. No, it should not be so. That is a violation in healthcare. In the healthcare sector. So every patient should be treated well. Yes, whether the person has money or not, you should not be denied of what? Treatment. 2, forced sterilization. You don't force somebody for sterilization. Yes. You don't impose anything on any patient. So that area can also be a violation that can attract sanctions. Yes, in the legal sector. The third one here is torture or inhumane treatment. Like I told you, somebody does not have money for treatment. You just say, go. No. You shouldn't do that. Adelina Lepuri, are you my student? Please go and subscribe. Click on the subscribe button. If you're my student, drop your full names and tell me if you are. So when a person is denied treatment, it's a violation of human rights. When there's forced sterilization, it's a violation. When there's torture or inhumane treatment, treating somebody as if it's not a human, it's a what? It's a violation of human Right. They will have medical experimentation without consent. This one is also very common. You just come to the hospital, Mr. A will come, touch you anyhow. B will come, touch anyhow. C will come. No. Before such things happen, they are supposed to seek the person's what? They should seek the person's permission. Yes, as a healthcare professional, before you attend to, even if you are a student in training, yes, before you touch any person, you should do what? You should seek the patient's permission. So you don't just start experimentation without consent. Poor prison healthcare. So because people are in the prison, that does not mean that they will not be taken care of. They are also taken care of. Adeline, have you hit the subscribe button? Go and do so if you have not. So there shouldn't be anything like poor prison healthcare. If a prisoner is sick, that prisoner should be well taken care of. So these are areas where there can be violation in what? In healthcare. Now move to the next one. What are the bodies, the international human rights instruments that are related to health? Take note. We have number 1, Universal Declaration of Human Rights. We call them UDHR. UDHR, Universal Declaration of Human Rights, recognizes health and well-being as human right. Thank you for the person who is sending me that emoji. Thank you so much. I love you. Okay, so let's continue. So you can send in more emoji, more likes, hit the subscription button, and also you can let people know, share this live to people, let them also come and join and learn, because that's why I said it's not just for my students alone. Yes, anybody should know this, both healthcare professionals and even people who are not healthcare professionals. Yes, you know your rights as a patient. Yes. So the first body, international human rights instrument I've mentioned, or body, is what? UDHR, Universal Declaration of Human Rights. So 2, we have the International Covenant on Economic, Social, and Cultural Rights, ICESCR. So this is another body that recognizes the right to the highest attainable standard of health. Then we have the next one, Convention on the Rights of the Child. Convention on the Rights of the Child. We call them CRC. What they do is they protect children's healthcare rights. Yes, children also are human beings. They also have human rights. So this Convention on the Rights of the Child helps to what? Protect children's healthcare rights. They'll have Convention on the Elimination of All Forms of Discrimination Among Women. We call them CEDAW. 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 So what they do is they protect women's reproductive and healthcare rights. So we move to the legal issues in healthcare. What are the legal issues in healthcare? We have what we call medical law. We have medical law. So I hope my students are following. If you have any question, feel free, drop it at the comment section. I will answer it. Drop it at the comment section. I will answer it. So as many people have seen us, please don't forget to like this live. Like the live, share it, write your comments down. If you have questions, feel free to ask. Okay, so medical law is a law that governs what? Professional conduct and healthcare practice. Medical law is a law that governs professional conduct and healthcare practice. Yeah, there's something called medical law. It's an aspect of law. Now what they do is that they govern what? Professional conduct. So if a professional does not conduct him or herself very well, medical law will what? Will handle that case. So medical law, we said, is what? It governs professional conduct and healthcare practice. If you're my student and you are seeing this lecture, please write your full name. Once I'm done with the lecture, I've taken my attendance, so it's only Michelle I have seen. Write your full names. Write your full names and tell me you are my student. Then go and hit the like button and make sure you subscribe if you have not. Okay, so what are the important legal concepts? The first one we're going to be looking at here is what? Negligence, which is a failure to provide proper care resulting in harm. For example, a patient comes to the hospital and the healthcare professional refuses to provide the health care that is needed. If there is a harm that the patient maybe there is the patient at the end of the day had one issue or the other in any area, that healthcare professional can be held liable. It can be held liable. We don't want to hear negligence. So that's why we said no matter who the person is, whether the patient has money or not, when the patient comes to the hospital, the patient is supposed to be what? Well taken care of. Yes. So after the treatment, the patient can be given the bill to pay. So I can see Igbinedio Grace at sir. You my student? If you're my student, please signify, let me know. It's only one person I have seen and I have acknowledged. That is Mitchell. Mitchell, please let us be obedient. To obey is better than sacrifice. Yes. Obey. Put down your name and let me know if you're my student. So I've said one of the important legal concepts is what? Negligence. Yes. Then the second one here is, okay, what are the elements of negligence? What are those things that are contained in negligence? We have breach of duty. And as I write, you're supposed to be in your workplace. You are the health care professional is nowhere to be found. Then when the patient now dies, they will now start saying sorry, sorry. There's something like that too. If the patient relative know their rights, if they hold that healthcare professional that's supposed to be around at that time, person will go in for it. Duty of care. Every patient brought into the hospital, yes, must be well taken care of. I've said that before. If you are seeing this live, please like it and share it to people, let them see and know that we are treating something very important. Yes. So under this element of negligence, I've said duty of care, I've said breach of duty. Injury occurred. A patient had injury because the healthcare professional is not capable or does not know what he or she is supposed to do. The healthcare professional will go in for it. Yes. So the second area of under our important legal concepts we are going to be looking at is what? Malpractice, which is professional misconduct or unreasonable lack of skill. So I just hope that this lecture will not take us more than an hour or an hour and 30 minutes. So we have professional misconduct or unreasonable lack of skill. That's another area where there can be what? Where that's an important legal concept that can be taken seriously. Yes. The third one is assault and battery. Assault and battery. What it means is treating a patient without consent may constitute assault and battery. You start with, for example, somebody comes into the hospital now. You want to operate on the person. Okay, Selma, I think your network is bad. You can't hear me? My network is not bad though. My network is going on smoothly. Can't you hear me? Mitchell, let me know if you cannot hear me. It's good. My network here is very good though. I don't have any form of hitches at all. No hitches at all. No hitches. If you cannot hear me, let me know. Because here now everything is going on smoothly. I don't have any form of hitches at all. But if you cannot hear me, let me know. Yes. So that I can stop this live now and continue again and start all over again. But I'm not going to start from beginning. We'll just do a continuation. If you cannot hear me, let me know. So I continue. Before you treat any patient, you must seek the patient's consent. You cannot imagine a patient comes into the hospital and okay, say it's paused. Is it still paused? Because on my own end here, it's not. Is it still paused? Can you hear me? Mitchell? Can you hear me? If you can hear me, let me know. Please, a minute. Splendor, come. Can you hear me? Before I kickstart, I want to be sure that you people can hear me. So I cannot look as if I'm just talking to myself. Please come. Help me so that I can remove this thing. Okay, if you remove it, I cannot plug this one. Let me connect my stuff. If you can, I'm just pausing this lecture now because of my students. Can you hear me? If you can hear me, let me know. Say I can hear you. Huh? So that was what I was wondering when you said, come and plug it for me. Don't worry. Come and plug it in. So since you can hear me now, I think it will be good to continue. Plug it there. I just want to be sure because no, see. I will plug it on the first one. So since you can hear me, invite others. Okay, Mitchell, I can hear you. Okay, hi. Adelina Lepuri, hi. See, pass it through the chair like that. So invite others, tell them that we are live. Oh, the lecture is going on smoothly. Oh, pass under the dining. The lecture is going on smoothly. Invite your colleagues. Invite your colleagues. My students, I'm talking to you. Wait. Invite your colleagues so that they can partake of this lecture. Have you on it? Okay. Invite your colleagues. Invite. I want to Give us just few seconds so that we'll balance ourselves up. Invite your colleagues. We have spent 30 minutes already on this live. I think we stopped at assault and battery, where we said it's one of the what? One of the important legal concepts. So I'm starting again since you can hear me. Okay. So assault and battery is when you have to seek the patient's consent first. You seek the patient's consent before administering any form of treatment. So if you don't seek the patient's consent, that is assault. We call it in the law court, it's called assault and battery. If you have any question, drop it at the comment section. I will answer you. Outside guy, thank you for joining us. Okay, Mohammed, thank you for joining us. Court letter, thank you for joining us. This lecture is a very interesting one. So invite as many persons as possible, let them join in and learn. So the third element we are going to be looking at, the third important legal concept here is documentation. Documentation means accurate medical records and legal requirements. So you see, when you go to the hospital, you see when a patient is being treated or attended to, you see the doctors, they're always writing. Yes, the doctors will write. Then we who are medical lab scientists, you go to our lab, if any patient comes for any laboratory test, we must document. Yes. Because in case something can come up tomorrow and they'll say, okay, this patient said this is what you did. Where is the record? Where is the patient's record? Do you have anything to show for what you have done? Well, you said, okay, you said this is what you did. The law court does not just accept what you said. What is the evidence? Show evidence. Show evidence that what the patient said is a lie. Which document do you have? You didn't document anything? Oh, sorry. If you did not document anything, you'll be held, you'll be going for it. So any form of treatment or whatsoever you are doing to that patient, please do well to document. Grace Beans. Say, if you're my student, I said type, I am your student. Yes, very simple. I am your student. Type P for attendance sake. Okay, let's continue. So, what are the importance of documentation? Why are we saying people should document? Number one, it can be used as an evidence in court. Somebody comes and is lying against you, and you said this is exactly what I administered to you. I administered this, I did this test for you, I did that. Say, okay, this was the result I got. And they are saying that you are the one that killed the patient, or you are the one that did this or did that. This is the result I got. Look at it. It's okay. Show where is it documented? No documentation in the lab, no documentation in the hospital, nothing. You'll be held liable. Yes, they will not listen to what you just said. Show evidence. So don't forget that you must always document. Okay, Grace, I can hear you, ma. Very good. Tell the other of your classmates to join in. So the only people I have seen now, you can hear me. Are you my student, Grace Beans? If you are my student, type it, I am your student for attendance sake to show that you are in this class. Okay, so let's continue. So we have talked about one of the importance of documentation. So it can be used as what? Evidence in the law court. Then for continuity of care, Mr. A may be the healthcare professional that attended to this patient in the morning. Then in the afternoon, another set of healthcare professional has come and they want to take over. That is why you need documentation. So they cannot continue from where Mr. B can continue from where A stopped. It's just for them to open up the patient's file and they will see everything that has been done. Okay, this is where these people stopped. Okay, let's continue from there. So for documentation, you must document. Very, very important. So you must document. So those are some of the importance of documentation. Then for also professional accountability. Yes, for professional accountability. So another legal concept we'll be looking at is patient rights. So I'm talking about patient right. What are these patient rights that we're talking about? Every patient has right to privacy. We don't disclose patient's results. We don't disclose patient's information. Even if the patient is, let's assume a female comes to the hospital now and her womb was removed. And you know that lady very well. Just listen up. So I want to ask all the people who are online now, I want to see your comments. What is your answer? Listen to this question very well. A patient comes to the hospital. The patient comes and probably she has done several abortions before, and now when she's rushed to the hospital, She was rushed in bleeding, and the only solution to that her bleeding is that they have to remove her womb. And you know this patient to be your brother's girlfriend who he is preparing to get married to. Are you supposed to go and tell your brother that he should not get married to her because she does not have womb? Tell me at the comment section. That is a question. So let's move on. That's my first question. So let me hear the answer for those who are online now. So patient rights, you said every patient have right to what? Privacy. Every patient have right to what? Information. The patient's information, the patient has right to it. Consent. Before you operate on any patient, you must see the patient's consent. Respectful care. The patient should be treated with respect. Forget about the fact that because the patient now is at your mercy. No, they will not start treating the person anyhow. Anybody can be a patient. Tomorrow you can be the one in the hospital who is not a patient. If you are treated that the way you are treating that patient, will you like it? I think you will not like it. That is why every patient must be treated with what? With respectful care. Let it be that it's at the point where the patient now comes to the hospital that they now met somebody that now relieve them of their health issues or symptoms. They now met somebody that now made their life better. That now made them to get their healing very fast. Okay. So every patient has right to what? Refusal of treatment. If a patient says he or she does not want, that is it. You don't force any patient. A patient, for example, a patient comes to the hospital and he or she, her blood level is low. Let's assume is 20%. And of course, we know that the next point of call is to what? To transfuse blood. And you have gone to tell the patient that to save your life, we have to do blood transfusion for you. And the patient is saying no. Even if the patient is your sister, even if the patient is your brother, even if the patient is your relation, even if the patient, whoever, every patient has what? Right to refusal of treatment. The patient says he or she does not want. It remains like that. The only thing you can do, you can plead with the patient. Okay, Grace says she's my student. Okay, I can see it. The only thing you can do is to plead with the patient to accept the blood transfusion for her, for his or her, what was it say now? For her sake, for the patient to get well quick and for the patient's life to be saved. But you cannot force this patient to take that blood transfusion. You cannot force a student, a patient, or you go and give the blood transfusion from at the back of the patient without the patient knowing. If that patient sues you to court, you will go in for it. So what are the emerging issues in bioethics? What are the emerging issues in bioethics? We'll quickly look at it because I want us to end this lecture in the next, at least by the time we are 1 hour. If we are not done, we should almost be through. Now, modern scientific advances create new ethical and legal challenges. Now, the first ethical issue we are going to be looking at, emerging issues in bioethics. The first one we are going to be looking at is euthanasia. I don't know how many of us have heard of it before. I'm still waiting for my answer. I asked a question. I said a patient comes to the hospital, and he or she, maybe it's your brother's girlfriend or whatever, and probably the person is bleeding, and the only solution to that bleeding is to remove the person's womb, and the patient is your brother's girlfriend, the person is preparing to get married to. What are you supposed to do? Are you supposed to now go to your brother and say, don't marry that girl again, no? She not get womb. Story. Are you supposed to do that? So let us know your answer at the comment section. Okay. So we said the first emerging issues we are going to be looking at. The first emerging issues in bioethics is 1, euthanasia. What is euthanasia, you ask? Euthanasia is the intentional ending of a patient's life to relieve suffering. The patient is going through a lot of stress. There are some countries where they do that. And the healthcare professional will say, this person don't too suffer. Instead of to suffer like this, so we just buy the life. Hello, are you the one that created the person? So euthanasia is one of the issues. So what are the types of euthanasia? We have the one they call the voluntary euthanasia. We have the one called non-voluntary euthanasia. We have the passive euthanasia. We have the word active euthanasia. Those are the 4 different types of euthanasia. So I'm going to be giving us the various definitions. Now, the first one we're looking at under types of euthanasia is the voluntary euthanasia, which is performed with patient consent. So if you are a healthcare professional in the hospital, and a patient is pleading with you to end his or her life, you go ahead and do it? That's my second question. This is the patient telling you now, he or she wants you to end his or her life. Do you go ahead and do it? Now we have the non-voluntary euthanasia. This one says patient cannot provide consent. Maybe it's a patient relative that is saying, go ahead and do it or whatever. The patient is in coma, and you now decide on your own as a healthcare professional to end the patient's life that the patient has suffered. Is it supposed to be so? Now, the third one is the passive euthanasia, where they gradually withdraw treatment or life support. But perhaps somebody is on oxygen, and they say, okay, go help this person, maybe for quick go heaven. So that oxygen that is supposed to preserve the person's life, now you now go and remove it, so that you speed up the buying process. Are you supposed to do that? Okay. Now the last one we're looking at here is active euthanasia. We say active euthanasia is what? Direct action taken to end life. You just go ahead once. This one now, it's not even the patient that is even telling you. You just go ahead and just buy the person's life like that. Okay. So we have ethical arguments supporting euthanasia. There are some ethical arguments that support euthanasia. One is what? That it relieves a patient from unbearable suffering. Is that a reason, a cogent reason that can make somebody to now terminate a patient's life? When we know that there is something called miracle. Have you not heard of miracle before? When they say miracle, no, they tire Jesus. So we have heard of cases where people who were at the verge of fact, they were almost gone. The whole system have started shutting down. All of a sudden, miracle happens. We have heard of cases of people that they have even taken to the mortuary. And before embalmment happens, somebody who was lifeless before, life started coming back and the person is still alive. So I've heard a lot of cases. So some people will say the reason why they want to just end the person's life, to terminate is to what? To relieve the person from unbearable suffering. Are you God? Are you the one that created life? That's one. Two, they'll say it is respect for patient autonomy. Patient say I should go ahead and end this for our life. You just go ahead and end the life. Is that so? So we say, okay, there's an ethical, there's also an ethical argument that is what? Against euthanasia now. The first one we said is what? Is ethical argument that supports euthanasia. Where we talked about relief from unbearable suffering, we talked about respect for patient autonomy, we now talked about preservation of what? Dignity. Maybe person is a very big man, they don't want him to suffer unnecessarily. Maybe he's not pooping on his body, or just let us preserve his dignity, and because of that, they just end the patient's life. Then the next one is ethical arguments that are what? Against euthanasia. One, sanctity of life. It is God that created everything on earth. There is sanctity of life. We cannot add a single strand of hair to our hair. So how dare you take life? Two, risk of abuse. If you allow euthanasia, people will start abusing it. For example, a healthcare professional in the hospital and the person is there and they rush in his or her enemy. Because they are permitted euthanasia, you just give the person something and use euthanasia to cover up. Three, conflict with medical ethics. We have what we call, just like we have medical law, we have medical ethics, yes. And medical ethics is against terminating somebody's life, yes. Life is supposed to be what? Preserved. We're supposed to do everything possible to make sure that life is what? Preserved. Okay, what are the legal status now when it comes to euthanasia? So the legality of euthanasia varies across countries. Like we said some countries have already permitted it. So, but some other countries have not. So it varies across countries. So countries where it is permitted, if such things are done, the healthcare professional may not go in for it. But countries where it is not permitted, euthanasia is not permitted, no healthcare professional has rights whatsoever to terminate a patient's life. So we have looked at one of the emerging issues in bioethics, which is euthanasia. We're not going to looking at, we're not going to looking at the next one, genetic engineering. Genetic engineering. Now, what is genetic engineering? Okay, I'm coming, please. Genetic engineering involves altering genetic material to modify characteristics. Altering genetic material to modify characteristics. What are the applications? The treatment, number one, is treatment of genetic diseases. Yes. You see somebody who was born with AS for some reason, they say they've changed the person from AS to AA. That is what we also call genetic engineering. Two, gene therapy, yes, where genes have been modified for some reasons. Okay. They will have agricultural improvements. So they also use it in the agricultural sector. In disease prevention, yes, for some reason, some people who are prone to some certain diseases, some form of gene therapy can be done to prevent such disease from what happening to them. Now, what are the ethical concerns when it pertains to this genetic engineering? What are the ethical concerns? One, what is the safety risk? Not after changing somebody from AS now to AA. The next thing you now hear is that the patient is having cancer. We have heard of cases like that. So, what are the safety risks? Okay. So we have under what are the under safety risk? Unexpected genetic effects can occur. Anything can occur as a result of that genetic engineering. Because God has created us. This is the way He has created us. And now you are changing that part all of a sudden. The system can start working against the person and something else will happen. Two, under ethical concerns, we have designer babies. Yes, we have a lot of test tube babies these days. Yes, it's happening. So designer babies. Now, concerns about selecting desired traits. Somebody can now say he or she does not want, maybe by the time they do the baby has started developing. The person wants a baby boy. And now the baby that is developing already is a what? A baby girl. They just buy the life and start all over again. So you see some of the concerns of this genetic engineering. So, three, social inequality. Access may favor wealthy individuals. Genetic engineering does not favor everybody. I'm very sure people who have done this particular thing I talked of, somebody who gave birth to a sickler and for some reason they were able to change the person's genotype from AS to AA. It's not small money. If you ask them, you know how many millions or billions of naira that goes in for that. So it only favor the rich and to not favor the poor. I'm still waiting for the answer to my question. Okay. Then we have human identity issues. Altering genes may affect human dignity and natural diversity. Somebody can be a boy and say, I want to become a girl, change my gene so that I will now become this one, change this one. So it can alter genes that may affect what human dignity. It's as if we will no longer take human life to be special or sacred. Okay. So another area we're going to be looking at as concerning emerging health issues here is what? Cloning. What is cloning? Cloning is producing genetically identical organisms. Yes. It's also very common these days. It's only humans now. It's difficult for them to do it for humans. But they're already doing it in some other things. Yes. They just clone a particular thing. Imagine you now seeing somebody that looks exactly like you. So that's what we mean. So what are the ethical concerns when it comes to cloning? Its identity and individuality is there. It can lead to exploitation. Moral status of cloned humans. Those, if they clone a human being, for example, will that human being will it be like the one that was created by God? We have heard of cases of robots and the rest. They can go and clone somebody and the human who is cloned does not have conscience. Just all of a sudden wake up and start killing people or doing one thing or another. So, moral status of cloned humans. How do we talk about that aspect? The moral status of them, of people who are cloned. So, another area we are going to be looking at is artificial intelligence in healthcare, AI. AI healthcare now. It is used for what? Diagnosis, of course, you know. AI has gone very far in artificial intelligence, where somebody can be here and be able to diagnose a particular disease condition, or somebody can use robotics and the rest to be able to identify some health issues. So it's used in diagnosis, used in robotic surgery. Yes, I've heard of case where somebody performs surgery on another person in another country, from one country to the other. In his country, he was able to perform surgery on another person in a different country entirely. So robotic surgery. We'll have medical imaging. They'll have health data analysis. Yes, health data analysis. Now, what are the ethical issues as concerning this artificial intelligence? One, data privacy. With the data, can robotics keep things private? Okay. Bias in algorithms, loss of human interaction. This one now is no longer human that is doing it. It's now robots and the rest are doing it. Accountability for mistakes. Who will you now hold? If, for example, a robot is the one performing a surgery and all of a sudden something else happens, who are we going to hold liable? Okay. So next one we're looking at here now is organ transplant. We have looked at the two major ones, so which is euthanasia and what? Which is I'm not getting interaction from my students. Please, I want my students to mention the two major areas we talked about when it concerns emerging health issues. What are the two major areas we first of all talked about? All these ones are just additional. We talked about euthanasia and one other one, the ones we talked about. So if you know it, drop it at the comment section. So organ transplants, we have ethical challenges. If you start allowing organ transplant, now ethical challenges can lead to organ trafficking, fair donor allocation, and consent for donation. Then we'll have also, as emerging issue, stem cell research. What are the benefits of this stem cell research? We have treatment of degenerative diseases. Yes, there are diseases that are degenerative that can lead to somebody dying. But with this stem cell research, like even the one we talked about, changing of genotype, such issues can be what? Arrested. Tissue regeneration. I've heard of a situation whereby they just cut out a little part of a tissue, and through their genetic whatever, you see the organ or the tissue regenerating and to be used for the patient. What are the ethical concerns? Destruction of embryos, I've said it before. For example, somebody wants a baby boy, and this time around now, they have done some kind of work they did, test two babies, and at the end of the day, the baby that they got was a baby girl. They will not kill that one and start all over again. So it can lead to destruction of what? Destruction of embryos. It can also lead to moral status of embryonic cells. Then we have another emerging issue here, reproductive technologies. Example of it is what? In vitro fertilization, very common, IVF. Yes, where they do the fertilization outside and inject it into somebody. So in vitro, example of reproductive technologies, we have in vitro fertilization. We have surrogacy. Yes, where a woman, for example, who cannot carry a child, they can bring in somebody else to help her carry that child. Surrogacy, sperm and egg donation. What are the ethical issues concerning this reproductive technologies? What? Commercialization of reproduction. People are not charging to in fact, God will have mercy. People are not paying money to have children. Yes, you pay money. So now becomes a business. We have parental rights disputes. We have religious obligations. So most religious sector will not accept it. You cannot come and explain to them about surrogacy. They will not want to hear it. They may accept IVF if, for example, the fertilization is between the man's sperm and the woman's egg. But in whereby somebody now comes and they're not using another man's sperm to fertilize the woman's egg. So most religious bodies will not accept that. Okay. We now have ethical decision making in healthcare. What are the steps in ethical decision making? One, you should identify the ethical problem. Two, gather relevant information. That's why we talked about documentation. Three, consider ethical principles. We mentioned principles almost from the beginning. We mentioned some ethical principles. Identify, evaluate, consider ethical principles. Now, evaluate alternatives. Then when you have evaluated alternatives, you make what? A decision from all this. Then not just making decision, the decision should be what? Implemented. Implement the decision. Then you review the outcome. Well, I was rounding up. I know by the time we're clocking 1 hour, we should be through with this lecture. But I told us this lecture will not exceed 1:30 by God. It's not even going to exceed 1 o'clock. So we're rounding up already. So what are the roles of healthcare professionals in ethical practice? Tell those ones who have not come to sign attendance here They should not come and meet me on WhatsApp. Oh. Let them come and they should come on live now and sign their attendance. They should come on live, tell me their name, and also tell me if they're my students. In the next 6 or 7 minutes, I should be done. So what are the role of healthcare professionals in ethical practice? One, healthcare professionals should, they should be able to respect patient rights. Very important. Don't undermine anybody, even if it's a child, even if it's somebody who is disabled, even if it's somebody who is poor. Yes, you shouldn't treat them anyhow. Respect patients' right. Two, you should be able to maintain confidentiality. You don't disclose the patient's information to anybody, except it is the patient that asks you to do so. Yes. So you should be able to maintain confidentiality. You should be able to practice honesty and integrity. Let people know you are someone who is truthful. Very important. Not the one that is like this. Okay. They should be able to follow professional codes of ethics. Every profession has their code of ethics. Yes, medicine has their own, medical lab has their own, pharmacy has their own, nursing has their own, like that. So follow your professional what? Code of ethics. We should be able to provide compassionate care. Every healthcare professional is supposed to have a what? A compassionate heart. Be calm, be sober. Somebody comes and the person is not feeling fine. Show care, show compassion, be involved. Don't make the person look as if the whole world has ended. Be compassionate. Then also, you should avoid discrimination. I've said it before. Don't discriminate for any reason, whether a person is poor or rich, or whether it's fair or black, or whether it's a male or female, or tall or short. Don't discriminate. Then in conclusion, we have here, contemporary healthcare practice involves complex ethical and legal challenges due to scientific advancements, cultural diversity, and changing societal values. Ethical dilemmas such as informed consent, confidentiality, euthanasia, and genetic engineering require what? They require careful decision making, guided by ethical principles. I've said this once before, human rights and legal standards. So healthcare professionals must remain knowledgeable. We don't have anything like because I did not know. That was why I gave the wrong drug. When I gave the drug that now ended the patient's life. No. So you must be knowledgeable. You must be compassionate and accountable to ensure quality and ethical healthcare delivery. Are we good? Are we good? So at this point, we have come to the end of the class. In this lecture, in a summary, okay, I'll be with us shortly. In summary, we looked at ethics. We said ethics guides moral conduct in what? Healthcare. Yes. That's how we talked about human rights. So most of this ethics will be talked about, will be taught your class by the other lecturer. Let's come and tell you what ethics is and some other things that concerns ethics. So ethics guides moral conduct in healthcare. We have looked at she will also teach you the ethical principles where you'll be looking at autonomy, beneficence, maleficence, non-maleficence, justice, and confidentiality. Okay. Then in this class, we looked at ethical dilemmas that arise when moral values conflict. We looked at human rights that I've said are closely connected to healthcare delivery. We cannot be talking about healthcare delivery without talking about human rights. And one of the human rights we have is that what? Everybody has right to health. Then we looked at emerging biological or emerging bioethical issues, which include euthanasia, genetic engineering, cloning, AI, etc., etc. Then we looked at the legal responsibilities include avoiding negligence and respecting patient rights. Whoever the patient is, the patient right must be respected. Then we also looked at ethical decision making is what? It's essential in professional healthcare practice. Ethical decision making is what? Essential in professional healthcare practice. We're almost 1 hour now. So I want to thank you for as many persons who were able to join us. Grace, it means I've noted your name as one of the students who attended this lecture. Then Mitchell also. Okay, Grace, it means is it? That's the lady of Grace that you know, sir, now. Then I noted your name, Mitchell. Mitchell also joined for this lecture. So you can share this live, share it to your WhatsApp group so that other of your classmates can see it and watch. So God bless you. If you have any question, drop it at the comment section and I'll be answering you. So I've handled my own part. I don't know if I introduced myself when I started. I did that. I am Dr. Mrs. Omogiade. Yes, I've handled my own part. So God bless you. The other lecturer will also, Mrs. Odige, will also handle her own part. Thank you so much for joining in. Do join me some other time for interesting topics like this. God bless you. See you in some other classes. Bye. Okay. I think we're done. I'm trying to end this live.